Yo, we're back at it again with the trunk and the spine. So it can get a little bit nebulous with this sort of stuff because there's some long names and they're deep and you can't really see a lot of them unless you're looking at these diagrams that I have for you. But we're going to dive into it today. It's your backbone. Spine's your backbone, right? It's the backbone of your body. It's going to support a lot of our movements. Anytime we're doing something, our spine and our core is going to have to engage to some degree. It's pretty hard to avoid that. Let's just review some bony anatomy right quick. The spine's made up of 33 vertebrae, five regions. Cervical has seven, thoracic has 12, lumbar has five, sacrum has five fused, and you have your coccyx, which is three to five fused vertebrae. That's your tailbone. Each vertebrae includes, a body, spinous and transverse processes for muscle attachment, a vertebral foramen for the spinal cord passage, and facet joints, which are going to guide movement and limit excess motion, right? In total, these bones form a triple curved column that balances mobility and shock absorption through the cervical and lumbar lordosis and thoracic and sacral kyphosis, right? If you don't know what those terms mean, just a quick review. Lordosis, let me give a pen. If this is our skull, yeah, there we go. There's our skull. Give it some teeth. This is our skull. Basically, what happens is your spine is not perfectly straight. Um, it has curves to it. So we have a cervical lordosis, and I'm exaggerating here, a thoracic kyphosis, a lumbar lordosis, and then a sacrocoxal kyphosis again, right? Let's dive into the ligaments now. The spine is reinforced by a network of ligaments that limit excess motion and protect neural structures, right? So if our spine is kind of shaped, basically you can kind of think of it as just like a marshmallow sort of shape with these little spines sticking out the back of it. Um, do like that. Um, well, it's not completely in the back, but you get the idea. Um, it just has ligaments that run in between it, right? So it doesn't bend excessively. Because remember, we have these intervertebral discs. If we put too much pressure there, or if we bend way too much, we might snap our spinal column. That's running through our spinal cord, I mean, that's running up through there. So you have to limit your range of motion, right? We have our longitudinal ligaments. We have our ALL, which runs along the anterior vertebral bodies and it resists hyperextension. So let's draw a little bit of a better picture right here. Anterior longitudinal ligament. So this is the anterior side, right? Ant for anterior. They're basically just going to run, use blue for ligaments, like that, right? And it's going to resist hyperextension of the spine. Remember, extending the spine is this right here. Extension, flexion. Posterior longitudinal ligaments is going to be inside the vertebral canal alongside the posterior bodies, and it's going to resist hyperflexion. So, or that is in the foramen right here, basically like that. And then when you try and bend forward, when you try to curve like that, it's going to resist that motion. You have your segmental ligaments. There's kind of a lot here. Ligamentum flavum connects the laminae of adjacent vertebrae. It's elastic and it resists flexion. Interspinous ligaments between spinous processes. So it's going to go spinous process to spinous process, and it's going to resist flexion as well. Supraspinous ligament tips of spinous processes becomes the ligamentum nuchae in the cervical region. Remember, nuchal is basically, I always just think of the back of the skull. You have those nuchal lines near there. It's basically just going to hold your head to your neck, which we'll get to the neck in the next video. And we have our intertransverse ligaments between the transverse processes, and they're going to resist lateral flexion of the spine. So they're going to just run alongside. These ligaments provide a passive restraint and contribute to proprioception, especially during trunk rotation and side bending, right? Which is important because that's, if you remember from A&P, your vestibular apparatus up here, it's basically just enhancing its function through proprioception. Now we're going to get into our stabilizers and movers of the core and trunk musculature. Also, the trunk are layered for dynamic control of the spine. We divide them into anterior, posterior, and lateral compartments. The anterior trunk is where we're going to get our flexors and compressors. Rectus abdominis, that's the big one. It's going to originate on the pubic symphysis. And I realized you can't see my mouse in these videos, and I thought you could. But let's see, did I get a highlight? Got a highlight on this? Yes. Okay. Awesome. So this is the pubic symphysis right here. That's where it originates. I'll do that. And it's going to insert onto the xiphoid process right there. Let me pick a brighter color. You can do that. There you go. Xiphoid process, pubic symphysis. Even brighter. Yep. And costal cartilages 5 through 7. So basically, you're never going to need to know that, but just think your lower rib cartilage. It's going to flex the trunk. It's going to posteriorly tilt the pelvis. So if you're ever confused about what that means, draw a pelvis right here. Think of your pelvis like a bucket, all right? And then this side's anterior and posterior pelvic tilt, you're tipping out the bucket towards the posterior side. Anterior pelvic tilt, you're tipping out the bucket towards the anterior side. That's all that means, like a bucket. And it's also going to compress the abdomen. So now we're going to talk about your obliques. Your external obliques originate on ribs 5 through 12, and they insert onto the iliac crest and the linea alba, which is this white, think about this white line. Alabaster pillars are white, just because tendons are white. Function in contralateral rotation, lateral flexion, and flexion. This is your external oblique right here. You see the fibers run downward like that. Internal obliques originate on the thoracolumbar fascia and the iliac crest. So they originate here, but they insert onto the ribs, which is just the opposite of your external obliques, which originate on the ribs and go down to the iliac crest. They function in ipsilateral rotation. So we got to know ipsilateral versus contralateral. External obliques are contralateral, internal obliques are ipsilateral. What does that mean? If we rotate our trunk to the left, that means that the right external oblique is concentric and the left internal oblique is concentric. And the opposites are the opposite. If we rotate to the right this time, that means our right internal oblique is concentric and our left external oblique is concentric. Let's kind of look at this. I'm going to draw a little Punnett square for you. That'll make things a little bit simpler. Okay, I'm back. This little Punnett square right here is money. Okay, this simplifies things so much. Any sort of twisting motion, any sort of bending motion, because I remember being asked questions. Well, if the right internal oblique is acting eccentrically and, giving you the eccentric and concentric actions of what's going on, this simplifies it a lot. So if the left external oblique is concentrically active, because that's all this is talking about, concentrically active, then that means, and the left internal oblique is also concentrically active, that results in left lateral flexion, right? But let's say the left one is active, the left external is active, but the right internal is active. That's right trunk rotation, right? So if we go back to our picture on the left right here, you can see how if both of these muscle bellies shorten, they're going to decrease the distance from here to here, right? But let's say the internal oblique on this side is right here. If both of those muscle bellies shorten, they're going to decrease the distance from there to there, right? Does that make sense? And that's all this is demonstrating right here. So when you get a question that's like, if the right internal oblique is acting eccentrically, then, and the right external oblique is also acting eccentrically, what must be happening? Well, if both obliques on the right side are acting eccentrically, that means we have left lateral flexion, right? So you can use this sort of chart to think backwards on that, especially if you do your movement analysis. That's going to be important if there's any sort of throwing or twisting movement. Fun fact, that took me 3 tries to do because it is a little bit complicated. All right, I had to jog my memory. Then we have our transversus abdominis. It's your deepest layer. Do we have a picture of that? See if I can. Yeah, transversus abdominis is like a really thin looking layer right there. Um, Wraps around the trunk horizontally, and it's going to increase the intra-abdominal pressure. Whenever you hit a Valsalva maneuver, you breathe in, you brace when you lift. That's your transversus abdominis function. It squeezes, right? Let's talk about the posterior now that we've gotten all that done. Your erector spinae group, iliocostalis, longissimus, and the spinalis, and that is lateral to medial. So from the outside to the inside, iliocostalis, longissimus, spinalis, which if you just pay attention to prefixes, you can kind of figure that out. Iliocostalis is going to be towards the ilium. Spinalis is the closest to the spine. They originate on the iliac crest, sacrum, and lumbar vertebrae, insert onto the ribs, thoracic and cervical vertebrae, and mastoid process. So they're basically from bottom to top, they're inserted to basically everything. And function, spinal extension. So we're extending, poking that chest out. They also have function lateral flexion if they act, one-on-one. So if you just have one spinal erector group concentrically active, that will laterally flex the spine. That makes sense. But together, they extend the spine. You'll see a similar thing happen with the sternocleidomastoid in the neck when we get to that in the next video. We also have our transversospinalis group. That's going to be your semispinalis, multifidus, and rotatorus. They're deep to the erector spinae, and they run from transverse to spinous processes, and they will function in spinal rotation and fine-tuned segmental control. Then we have our quadratus lumborum, which is this muscle is so important. If you have a weak one, if you're like me and you're a pretty leggy person, injure your back, if you're doing specifically barbell back squats and stuff like that, you might tend to get a tight quadratus lumborum. You can see it right there on the hip. Let me get my pen out so you can actually boop, quadratus lumborum right there. Basically, it's going to control hip hike. It's going to originate on the iliac crest, insert into the 12th rib, and transverse processes of L1 through L4. Lateral flexion, lumbar extension when they're acting together, when both sides are acting together. It's going to stabilize your ribs during breathing. But yeah, hip hike, think stepping over like a small object, like getting to the bathtub, right? That's the classic one. You can also do QL raises, which are going to work your spinal erector groups a little bit and lateral flexion, but definitely recommended if you find that you are constantly injuring your low back. It's going to feel like, man, my low back right above my butt cheek hurts. That's your QL, is what I learned. Then we can talk about some integrated muscles of the back. We brought these up before. Latissimus dorsi connects the upper limb to the trunk and extends and adduct the humerus. It's going to be a big muscle that's kind of covering everything here. So it's going to play a role in the overall function of the back, of course. Psoas major is going to connect the lumbar spine to the femur and contributes to hip flexion, spinal stabilization. So, we always talk about tight hip flexors and stuff like that affecting how our back feels. Let's talk a little bit about functional integration in the core as a system. Spinal movements include flexion, extension, lateral flexion, and rotation, right? Flexion is mostly your rectus abdominis and obliques, extension, erector spinae, and multifidus group, and lateral flexion, quadratus lumborum, obliques, and iliocostalis. Rotation is going to be your internal and external obliques working, like we said, in our little Punnett square, and your transversospinalis group. The core, as a stabilizer, works with the diaphragm superiorly and pelvic floor inferiorly. So pelvic floor and diaphragm are the ceilings of the core. Together, these are going to regulate intra-abdominal pressure, protecting the spine during lifting, twisting, and bracing. When it comes to spinal load transfer, forces from the upper body are absorbed and distributed by vertebral discs, facet joints, and muscular tension. Coordinated contraction of the core muscles prevents excessive shear and torsion. But yeah, we're going to get into just a little bit of ultrasound here and hopefully be able to see things. I focus mostly on the QL. It's a kind of difficult to see a lot of these groups because they are kind of small and shrimpy, usually, especially the long ones right here. We're not going to be able to see stuff that's super deep, but you can kind of see a contraction. You kind of get a cross section of them, so you can see how thick they look on average. But yeah, thanks for watching this segment, and we'll get to the ultrasound here. All right, now we're going to be taking a look at the trunk and spine. I'm going to focus in today on the spinal erectors and the quadratus lumborum. I've got Tristan on the floor over here. He is on all fours, and I'm going to first show you the muscles, and then I'm going to have him do a couple of movements, and you're going to get to see him contract, hopefully. So, first things first, lift him up. God, is somebody walking us on? Hey, yeah, we're doing normal shit. Alright, let's see what we can see. Yep, there we go. Alright, so I have a cross-sectional view of basically the lower aspect of Tristan's spinal erectors. This is in his lumbar region. Now what I'm going to have him do is a bird dog, and we're going to get to see how these react. So what he's going to do in a second is he's going to raise his left hand and extend his left leg. So go. Yep. Raise it. Oh, my bad. Raise his left hand and extend his right leg. Okay. He did the opposite of what I said. But that's okay. You can actually tell he did the opposite of what I said because the right side is a little bit more contracted. Now, if he relaxes. Oh, wait, did you switch it while I wasn't looking? No. Oh, never mind. Hold on. Go back and do that again. Raise his right hand. Go back. Shit, I slid. Yeah. So you can see the activity of the spinal erectors here. They are contracted asymmetrically. Now do the other side. Okay, swap. Try and stay on the image. Yep. And you can see the asymmetrical contraction there of the spinal erectors. Get back in the center there and relax. Good. All right, now we're going to take a look at his quadratus lumborum. So what he's going to do is a hip hike maneuver. What he's going to do is essentially take his hip and move it, kind of crunching his oblique a little bit. But he's going to move from the hip, not from the oblique. So we're going to take the gel, we're going to move it right down here. And let's see if I can find it. There we go, I think I found it. All right, now do the hip hike maneuver. Then you gotta move your actual hip. Yeah, like that. There we go. All right, now back. Relax. And again, is Tristan. I'm gonna hone in on one of the spinal extensors, and Tristan is going to do a cat-cow. So you're going to punch your back and extend. Yep, okay, and then again, and extend. And you can kind of see the you can see the activation of all the spinal erectors right there. The particular area where I'm focusing in on, do it again, Tristan, is where they kind of split off and attach to the lower aspects of the ribs. Especially if I go like right here, you might see it a little bit better. And relax, good. Let's see if I can get a little bit of transversus abdominis. If you look there in those deep structures, you can see the overlapping three layers of, two of the overlapping layers of the abdominals. You have the transverse, you have the internal and external obliques, and then the transversus abdominis. Well, that is three layers, my bad. See the external oblique on top, and then you can see where the internal oblique inserts, and then a little bit on the right side of that transversus abdominis starting.